us on the map. Mr. Caruana leading the beat. Australia global rank 6. Feeling the heat like immortality.
All right, so welcome to our first video for HSC HMS. We are looking at our topic being health in the Australian and global context, or HAG, HAG-C for an abbreviation. I don't know, I don't like HAG-C. I might just call it HAG. Let's go with that. So much of this video is actually going to be very similar to the one you did in Year 11 because pretty much the same syllabus dot point exists in the Year 11 prelim syllabus and the Year 12 syllabus. So that's cool. So what we are actually doing today is analysing the current health status of Australians. So in this video, I will go through the statistics and trends that you need to know for the HSC. Now, keep in mind that you do not need to memorise exact statistics. What you do need to memorise is how it is trending. So whether things are getting better or whether things are getting worse, and then we investigate and analyse why things are getting better or getting worse, okay? And that's really the nutshell of this whole topic. Before we start, I just wanted to retouch on these key terms that you would have learnt in Year 11, but if you can't recall these or you don't remember them, it's probably really important before we actually go into statistics so you know what we're talking about. So we have our 4 measures of epidemiology. Remember, epidemiology being the study of the health of a nation. So our measures are mortality, morbidity, infant mortality, and life expectancy. Mortality is very simply the rates of death from a particular cause. Morbidity is the rates of illness from a particular cause. Infant mortality is the rates of death for infants under the age of 1 per 1,000 live births. And life expectancy is how long you should live determined at your birth, okay? And I remember in the Year 11 video, I did speak about how my life expectancy back in 1984 is much different to someone who was born today's life expectancy. Then on top of that, we had our indicators of morbidity. So these are the things that tell us illness. And we had incidence and prevalence. So incidence is very simply the rates of new cases developing over time. And prevalence is the number of cases at any given time, okay? So they sound very similar, but you can have something that has a very high incidence, number of new cases developing, and very low prevalence. Okay, so and I think I gave the example, or if not, a suiting example would be when COVID-19 first hit, okay? The incidence rate was huge. Number of new cases developing in February, March, back in 2019 or 2020, whenever that was, huge numbers. But the amount of actual people compared to other things in the world, very small. And then obviously this grows over time in relation with the incidence rate. Okay, so basically incidence is the very first thing that epidemiologists look at, and then they go, oh, hey, we're seeing these rates of new cases for XYZ developing. We need to do something before the prevalence becomes a massive problem. And in COVID-19's case, it did, because it has then stuck up into our top 5 for mortality rates, which we will go through. Okay, so in a general sense, what does the current data tell us? So for record, the current data that we are using in today's video is from the 2024 AIHW report. So the AIHW is the Australian Institute of Health and Welfare. They work together with the ABS to put together health reports. They usually do this annually or biannually. Some of them actually come out every 4 years. And it basically goes through all the statistics and trends, okay? So this one is based off 2024. We will probably get an updated version next year at some point. So, according to the current data, Australia has excellent health globally. Okay, we're actually rated in the top 10 as far as life expectancy goes. Okay, we're also rated in the top 10 for the amount of healthy adjusted years that people are living for, and we are rated in the top 10 for lowest amounts of infant mortality, okay? So there's lots of good things about Australia's health overall, all right? So that's a very, very positive thing. So infectious diseases, so these are things that people get and then they pass it on to other people, are going down, okay? Which is excellent. But chronic non-communicable diseases, so the things that people get that they can't pass on, are going up, And this sort of trend is going to continue throughout this video, all right? So then we've got this measurement called our DALY, all right? So disability adjusted life years, so is our DALY. It is a combination of people who are living with a disability, as in like people who have gained a disability from a health condition, okay? Which we summarize by saying YLD, plus the years of life lost, which is our YLL, okay? Due to premature death. So for example, if I was born in 1984 and my life expectancy was 70, okay? And then let's say I died when I was 60. There are 10 years of life lost for me because my predicted life expectancy was 70. I died at 60, so therefore that's -10, all right? So that's how that works. If we take this into account, infectious disease is going down, living chronic disease is going up, we can therefore say that people who are living with a disability is going up, okay? So people who may be disabled due to heart conditions, okay? They can no longer walk, they can no longer work, they can no longer walk, they can no longer do things because, they're either bedridden or they're housebound because they can't go any further because it places too much stress on their heart, okay? So all those people that have a condition or a disease that has permanently disabled them for the rest of their life, that's going up. There's more and more and more of those people every single year, okay? And over the last 20 years, it has had a drastic increase, okay? And you can see that with our population count. Our population count's going up. People are living older, okay? But because people are living older, a lot of those people over 65 have some sort of condition, all right? It's very rare to actually find someone who is over the age of 65 or 70 who doesn't have a condition, okay? However, the good news, backing onto Australia's excellent health, our years of life lost is going down. So this is premature death, okay? So if I was, once again, born in 1984, I had a life expectancy of 70, and I lived to 70 or above, then I am a statistic in not contributing towards this, okay? So what the data here is basically saying, in a nutshell, is that less people are dying early, but we have more older people with conditions, all right? I'll tell you what, I'll write that up, because if that's the only thing you remember from the first 10 minutes of this video, good for you. Less people are dying early, but more people are living longer with chronic conditions and disabilities. Let's do some stats. All right, so we're going to go through our statistics here. So these statistics are pulled from the 2024 AIHW report, all right? However, the 2024 AIHW report examined the 2022 Australian Bureau of Statistics data. So the data is actually from 2022. And as an interesting note, I've also pulled the 2024 Australian Bureau of Statistics data to show you how things are trending. Now remember, we don't need to know numbers, so I haven't included any numbers here except for life expectancy. But you don't need to know that as well. Anyway, so let's talk about it. So first of all, life expectancy. So someone born, well, technically in 2022, but 2024, let's go off the 2024 AIHW data. So someone born according to the 2024 AIHW data, if you're a male, you'll live to 81.6 years on average, and females are living to 85.5 years. These numbers are both trending upwards, okay? It's important to note that there was actually a slight drop in the trend between 2020 and 2022 due to the enormous amounts of deaths that we had due to COVID-19, but that is now back on track to going up and up and up again. So if you look at the graph, and I will overlay a picture of the graph, you can clearly see life expectancy data going up consistently. So that's good. Causes of mortality. So these are major causes of death. I've only included top 5. Once again, you only need to know the way that they're trending. So in the 2024 AIHW data report, they had coronary heart disease as number 1 for males, dementia and Alzheimer's as number 2, COVID-19 is number 3, lung cancer number 4, and stroke as number 5. Stroke is the term for cerebrovascular disease. Now, interesting to note, all of them are trending downwards except for dementia and Alzheimer's. There is still actually quite a large gap between heart disease and dementia for males, and a lot of that data is simply due to more males suffering from heart disease because of diet, exercise, not seeing GPs, not getting medical advice, etc., and we'll talk about that later in the unit. But secondly, because males don't on average live as longer, and we know that dementia and Alzheimer's is definitely a developing disease, especially the older you get. Now, COVID-19, when this data was taken, it was actually rising. So 2022, it was massive as far as deaths. However, I've said it's trending downwards because when you pull the latest data from the Australian Bureau of Statistics, which is actually the end of 2024, here is the top 5 causes of death for males in Australia. We had heart disease, still number 1, dementia, still number 2, COVID, gone, okay? It's actually, I think it was 10th or 12th. 12th, let's go with that. So you can see that while it is here in the 2024 AIHW report, it is no longer a major cause of mortality in Australia. So it is trending downwards significantly, which is excellent. So therefore we had number 3 as lung cancer, number 4 as lower respiratory diseases. So other complications that come from smoking and vaping other than lung cancer, bronchitis, emphysema, COPD, stuff like that. And then number 5 is stroke. Okay, so all of these, basically all you need to really remember is that these are the top 5 for males in the 2024 AIHW report, and they are all trending downwards except for dementia and Alzheimer's. Okay, so our data for females. So number 1, we've got dementia and Alzheimer's again, which is still trending upwards. Number 2, coronary heart disease. Number 3, stroke or cerebrovascular disease. Number 4, COVID-19. Number 5, lung cancer. So all of these things, same as the males, they're all trending downwards except for dementia and Alzheimer's, which is going up. And do keep in mind that this list looks pretty similar to the male list, except that dementia and coronary heart disease have swapped our positions there, as has sort of stroke and COVID-19, etc. Once again, just to compare, so our latest data that we actually have from the Australian Bureau of Statistics, we've still got dementia at number 1, coronary heart disease number 2, stroke at number 3, lower respiratory diseases, so remember we talked about that before, as number 4, and lung cancer as number 5. All right, so pretty much the same data for females, and once again, the trends are all the same too. Now, I did want to add this in, combined data for all Australians, so males and females and males and females is the only data they pull. The first thing I want to say is this top bit, all cancers, all right? When you put all the cancers together, so like skin, breast, lung, prostate, throat, etc., all cancers is actually the number 1 killer of Australians, all right? When you put all those data together. But when you separate them into separate cancers, they fall lower on the data line. So all cancers is number 1. That's important because in the HSC in the past, they have actually asked the question like, what is the number 1 killer of Australians? And they have like dementia, and they have like coronary heart disease, and then they have an option like in multiple choice that says all cancers. So good to know. But then when you put the data together and you separate them into their bits, you've got dementia number 1, coronary heart disease number 2, lower respiratory diseases number 3, stroke number 4, lung cancer number 5. And once again, all of these things are trending downwards, except for dementia, which is trending upwards. So then finally, we're going to look at our morbidity data. So this is the data looking at rates of disease or long-term health conditions. So these are the things that people are living with, suffering with, seeking help about, but not necessarily causing them death yet. Okay, so then eventually these things can eventuate into cause of death, but it doesn't always happen that way, as you'll see. So males. Number 1, we've got back problems. Number 2, anxiety. Number 3, hearing loss. Number 4, depression. And number 5, asthma. Now, interesting to note that obviously you can see that none of those things are they are leading causes of death, but these are things that a lot of males, especially as you get older, are suffering from. Interesting to note that most of these things are also, except for asthma, trending upwards. So there are more back problems, there's more anxiety, there's more hearing loss, there's more depression, okay? And a lot of this, and like I said, we'll talk about it later in the unit, but you can start to think about, well, you know, the average age of retirement in Australia is getting longer and longer and longer, so people are having to work for many, many, many more years, and therefore, with the cost of living and all those aspects going into it, and people were living busy lives, working longer hours, working longer for longer in general, things start to break down. Their body starts to break down, or they're not giving themselves enough time for themselves and self-care and all this kind of stuff, all right? Females are very similar list, okay? Number 1, anxiety. Number 2, back problems. Number 3, depression. Number 4, asthma. And number 5, arthritis. Now, the interesting thing that you probably need to take away from this is this. So remember we spoke in the previous screen about DALY, so disability adjusted life years, all right? These are the top 5 conditions currently in Australia which are causing the most disability adjusted life years. So this does, to a degree, account for you know, total permanent disability, which is like coronary heart disease and stuff like, and I spoke about you might be housebound or bedbound or whatever, but also these things which are requiring people to maybe stop working or, you know, end their work career early or change work, etc. So top 5, and they are all trending upwards except for number 1. Number 1, we've got coronary heart disease, and that overall throughout all the data today, you can see that that's constantly going down. Number 2, back pain is on the increase. Number 3, anxiety on the increase. Number 4, depression or depressive disorders on the increase. And number 5, dementia also on the increase. So the takeaway, and I had it in the previous slide, is that from all the data, you can see that we have less people dying from like acute causes of things in Australia, but more people are living and living older and therefore living with more conditions because of the way society is. So now we'll go through, get this off and go through some sociological causes for the data.